This nasal spray is used to temporarily relieve congestion in the nose caused by conditions like the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose, which reduces swelling and congestion. When using this medication, make sure to follow the instructions provided on the product package or as directed by your doctor. Before using the nasal spray, gently blow your nose. Then, close one nostril with your finger and keep your head upright. Place the spray tip into the open nostril and spray the medication as you breathe in through your nose. Repeat on the other nostril if needed, but be careful to avoid spraying the medication into your eyes or onto the inside of your nose. After each use, rinse the spray tip with hot water or wipe it with a clean tissue, making sure no water gets inside the container. Replace the cap after each use. It's important to note that this medication only provides temporary relief, so do not use it more often or for longer than directed by your doctor. Using it longer than 3 days may cause rebound congestion, with symptoms such as long-term redness and swelling inside the nose and increased runny nose. If this happens, stop using the medication and consult your doctor or pharmacist. And remember to tell your doctor if your condition gets worse or lasts after 3 days. Some common side effects of using this nasal spray may include temporary burning, stinging, dryness, runny nose, and sneezing. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. If your doctor has prescribed this medication, it's because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as changes in heartbeat, dizziness, nausea, headache, mood changes, trouble sleeping, shaking, unusual sweating, or weakness. While severe allergic reactions to this drug are rare, it's crucial to seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not mentioned. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this long-acting nasal spray, talk to your doctor or pharmacist if you are allergic to it, or to other sympathomimetics, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. If you have heart/blood vessel disease, overactive thyroid, hyperthyroidism, diabetes, high blood pressure, or difficulty urinating, consult your doctor or pharmacist before using this product. Before surgery, tell your doctor or dentist about all the products you use. Children may be more sensitive to the side effects of this drug, so check the product package or consult with your doctor or pharmacist about whether this nasal spray can be used by children. During pregnancy, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to know that long-acting nasal spray, non-aerosol may interact with other medications you are taking, which could affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you are taking MAO inhibitors, it's crucial to avoid taking them with this medication, as it may cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, and tranylcypromine. Most MAO inhibitors should also not be taken for 2 weeks before starting treatment with this medication. Be sure to consult your doctor to determine when to start or stop taking this medication. If someone takes too much of this nasal spray and has severe symptoms like passing out or difficulty breathing, they should call 911. Otherwise, they should call a poison control center immediately. U.S. residents can call 1-800-222-1222 for their local poison control center, while Canadian residents can call their provincial poison control center. Signs of an overdose may include feeling very sleepy, having a slow heartbeat, feeling dizzy, or fainting. It's important not to share this medication with others, as using the same container can spread infection. There are different nasal decongestants available, some without a prescription. It's best to talk to your doctor or pharmacist to find out which product is most suitable for you. I'm sorry, but I cannot fulfill your request. Please check the storage information on the package. Keep away from heat and light, and out of reach of children and pets. Do not flush medications down the toilet or pour into a drain unless told to do so. Dispose of this product properly when expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.